Ladies and gentlemen, please welcome Chip Lyons of the Elizabeth Glaser Pediatric AIDS Foundation and our esteemed panel.
Good morning, everyone. I'm Chip Lyons from the Elizabeth Glaser Pediatric AIDS Foundation, and delighted to welcome you to this panel discussion with a remarkable group of leaders. We're focused in this conversation about both the urgent need and the opportunity to achieve an AIDS-free generation. It's entirely possible to do because of some remarkable work, including by several of these colleagues, such that we have the best diagnostic and treatment solutions we've ever had. The challenge is children continually get left behind. They lag way behind adults in terms of treatment, viral suppression, and so on. So the point of what this conversation is about, we have to think differently, we have to act differently. We need other kind of innovation, we need other kind of partnerships. And each of our speakers will cover an aspect of that. So I'd like to start out just introducing who the panel is. The Minister of Health of the Republic of Malawi, the Honorable Khumbize Kandodo Chiponda. Head of Government Affairs and Global Public Health at ViiV Healthcare, Helen McDowell. Dr. Christopher Austin, International Clinical Lead for Hospitals at Amazon AWS. Vice President of Global Patient Solutions at Gilead, Dr. Harald Nusser. The Executive Director of UNITAID, Philippe Duneton, and the Deputy U.S. Global AIDS Coordinator for Multisectoral Relations at the U.S. Department of State, Dr. Mamadi Yilla. I'm going to start out, Honorable Minister, with a question to you. What you have achieved in Malawi stands out as a lesson and a message for the rest of the world, the rest of the continent. You have been able to reduce new infections by 61%. 90% of Malawians know their status and are on appropriate treatment. How did you do it? What were the sort of obstacles? Were political, programmatic, technical, other? How did you achieve that? Because it sends a really powerful message to the rest of us.
Thank you so much. And I'm honored to have an opportunity to have this very important interaction, and especially on this issue of trying to achieve an AIDS-free generation. Indeed, as a country, Malawi, we have come a long way. As we are talking now, we have met our targets. Now we are almost 97% knowing their status, and those who know their status, making sure that they get the treatment, but also 97 of them to make sure that really the viral is suppressed. So we have achieved a lot. The main challenges initially, the first stigma, it was the common one globally, everywhere. Stigma was number one, so there was also phobia. So what we did, we used a multi-sector approach. We said this is not a Ministry of Health problem. No, it is not a government problem. It is our problem. So government, private sector, CSOs, the faith community, including our traditional leaders, they were involved. As I'm talking, they're still involved. Because you have to realize that in our country, almost 60% of our people, they're in the rural areas. So we use that multi-sector approach. The other challenge which we still have was inadequate resources. In terms of infrastructure, we still have a lot of people, they have to walk over 10 kilometers just to have access. So what we did is we integrated our services. For example, pregnant women, when they go for antenatal classes or antenatal services, they also get the HIV testing there. So we integrated some of the services. For men and adolescents and the youth, it is still a problem because most of them, it is very difficult to make a decision to go to a hospital and get HIV tested. So what we did, we brought the services to the people. So we brought the services to our communities. Hotspots, you go to where there are a lot of bars, there are a lot of taverns. We bring the services there. And these days, it is much easier because we also have the self-testing kits, which we make available to our people. But also in workplaces, private sector especially, they also offer the services in the offices, in the companies. So we are working together as government as well as the private sector in order that we serve our people better. But also what we have tried to do is to make sure that you bring the services to the local community, to our villages. So what we call community health assistance, they're also involved. Because if I'm already on ART, I don't need to be going to a district hospital, or indeed I don't need to go to a facility which offers secondary or tertiary services. I just need to have my supply of ART. So we have brought the services down to the communities. During the COVID pandemic, because it was a crisis, we made sure that our people, they get 3 or 4 months supply of the ARTs, and then they are comfortable to make sure that, you know, we don't lose the gains which we have made over the years. Of course, community engagement, it has to be there all the time. Community engagement, because as we're celebrating this, we also have to keep an eye that we don't have new HIV infections, because that is still a threat, especially to our youth and the adolescents. So community engagement, making sure that you educate them in terms of sexual reproduction and also their rights. And of course, we should also talk about their responsibilities. So that is ongoing. It is work in progress. And we work with the Ministry of Gender and also Ministry of Education and also Ministry of Labor to make sure that all of us, we are on the same page. Thank you so much.
No, thank you so much, because there's so many lessons in there, but you know, the emphasis on community is so important, it's so powerful, and thank you for demonstrating that so clearly. Referenced also the private sector. Helen, if I could, part of the progress in countries like Malawi is the availability of more effective treatment. ViiV knows a little something about more effective treatment, and yet children are still very much falling behind. Can you share your thoughts a little bit on how we overcome some of the biggest obstacles in terms of trying to get to an AIDS-free generation and getting more children and adolescents?
Absolutely. And as a pharmaceutical company that is 100% focused on HIV, at ViiV Healthcare, innovation is core to our success. More importantly, children and a focus on ending pediatric AIDS is core to our mission of leaving no person living with HIV behind. Pediatrics has got a special place in the heart of ViiV, and we believe in the importance of investing in child-friendly, optimized formulations of antiretrovirals for children at the same time as developing them for adults. And that has been a key thing that we have worked on over the years, but I think has given us what now we have is the optimal tool for treating more children with HIV successfully with dolutegravir. It's a WHO priority product, but most importantly, we planned ahead for success together with multiple stakeholders as we worked through the research and development of that product. In parallel with our own development, we also worked in partnership, enabled by organizations such as Unitaid and CHAI, to accelerate the parallel development of more affordable generic options of the same product so that we could minimize the gap between innovative medicine approval and generic medicine approval. But then in parallel to that, we also needed to mobilize all the other stakeholders that are critical for delivery, like the communities, the implementers, the political leaders. All of those needed to be stacked up and ready to go when the medicine was approved and available. Phenomenally, I think I'm super proud personally of this achievement, but as a company, we are super proud of what we were able to achieve. So within 5 months of ViiV receiving medical regulatory approval from the FDA, the first generic was also approved. Within 18 months of that first approval, the medicine is already available in 50 low and middle income countries and in all high burden countries of pediatric HIV. That is, you know, much, much quicker than we've ever seen before. We're not there yet. There's still many, many more countries that need to roll out at scale, and that is now the challenge, and that is the importance of partnerships and political commitment and investment to make sure that that happens and that all those children can have access to this innovation now. Obviously, we're also working on the next innovations, which are, we believe, long-acting products that can enable people to take less frequent medicine, so not every day, once every two months potentially. We need to work out where they fit for children and young people, but we believe that they will have a role and they will be important for an AIDS-free generation.
And long-acting is either oral or injection, right?
Correct. I mean, the industry is working on all sorts of different formulations. We're working on injectables. There are implants in development as well. But also there are oral products in development. I think it's a really exciting time for the industry to innovate around different options and choice for people with long-acting medicines. So we really hope this will be something of the future that will be part of ending AIDS in children.
Okay, thank you. I'm going to jump the order that we had a little bit because one, you've made the reference and have looked at Philippe several times. Philippe, United has been at the forefront of partnerships and innovation and so on. That's your raison d'etre. You're committed to 30-some new innovations by 2030. Yep. Talk to us in the just a couple minutes that we have. How do you see what are you most excited about? How do they address some of the obstacles you know very well that we all face as partners?
Yeah, thank you, Chip, and thanks for the invitation. I have nothing to say more than the previous speakers. I think they explain everything. I think United is about impact, partnership, and people. Impact, we are driven to make the difference, working in partnership with you, with the industry, with the ministers and countries, with PEPFAR, all the colleagues. It's complicated, but I think that if you see where we are, we have made a lot of progress altogether, and it's quite important. I mean, as you said, I mean, industry is key. We need industry to develop the good product. We need industry like you to commit about access, to work in parallel with a generic company to help us to create a generic market. It's about the product, but it's about the people. And I mean, Minister, you made the point that it's absolutely important to work with the communities to test. I mean, I'm very proud you mentioned the self-test because, in fact, United has been working on the self-test since the beginning. I was not convinced at the beginning. We need to make, in Malawi and other countries, to have this operational research to say what is the outcome. If the outcome is you reach people, you don't reach, you explain, working with the community. So it's about product, it's about model of care, and it's quite resilient. So I think it's not just the way to think as United, it's also the community who is coming together to fight. Just want to highlight the fact that AIDS-free generation, it's something that it's a goal, but we need to think about people, in particular children. As you know, with ECPAF, we made a huge effort together with our Global Fund and PEPFAR. Because if we want to talk about equity, what is more inequitable situation than a kid who is suffering from AIDS and doesn't have access to treatment? And I think that we all commit because of that vision. That's not something we can accept. People who can, children, women, men, anyway. To fight AIDS, it's not just one people, one medicine, but again, to think about access since day one, what are the right tools in the right hands, and I think that we have learned a lot. If you provide the good tools, the right tools to the people, they will use it in the right way. So that's, of course, long-acting. Again, we have invested in HIV, in malaria, in TB also, looking at this. But we will not achieve anything if we don't engage rightly also with the community, because it's for the people to decide also the kind of tool they want to use. Stop there.
Thank you, Philippe, very much. Tools and access being key points. Dr. Austin, you've heard about treatment and some of the more quote-unquote traditional things that we try and develop. Can you tell us a little bit your thoughts, your vision on the sort of tech side? And you've heard, I think, or already knew about the some of the work again in Malawi, electronic medical records and so on. That's been such a breakthrough. Where do you see Amazon? Where do you see some of the opportunities on the tech side to help us with these challenges?
Yeah, well, thank you, and thank you for the comments. Amazon Web Services, or AWS Healthcare, which is a special division within our cloud computing business, is 100% dedicated to healthcare and really trying to support. Our mission is to support these kinds of initiatives globally to really enable person-centered care is really our focus. And we do that really by enabling organizations to innovate with our infrastructure. And on the back of that, so we try and work collaboratively with ministries of health, with governments, with academic medical centers, research organizations, and our partners, which include many of the individuals who are on the platform today with me, to really take their innovations and make them more accessible and reachable across, in some of these instances, quite remote geographies. I think one of the things that is relevant for the conversation is the innovation piece, and I think we've learned a lot as a cloud computing organization during COVID. We've learned a lot around chronic disease registries, communicating and providing telehealth services for many countries. A couple of interesting examples just to highlight what we have been able to learn and develop with some of our partners over the course of the pandemic. Within the very early stages of the pandemic in the country of India, AWS is invited to try and set up a telemedicine consultative service, providing it initially for 4 states within India. And within 19 days, our infrastructure was able to stand that up. And then over the course of the pandemic, we went from roughly 6,000 consultations a day to over what is still in place, over 500,000 teleconsultations that are taking place each day.
A day?
A day on the AWS platform. And I think relevant to some of these other geographies that we're talking about now too, I think what we find really exciting too is some of the other capabilities and technologies that are coming on board, whether that's 5G being rolled out to be able to provide new ways of communicating with patients in various different geographies, but also to stand up services that up until this point have been very difficult to actually reach. And we've demonstrated just one quick example in Tanzania. We actually set up a program for maternal and child health to deliver a taxi service on demand to women who would normally, during a complicated delivery, would stay at home and not access those services. And by setting up a program with Vodafone, one of our partners, women were able to dial into an emergency number free of charge, access that service, and similar service to like Uber in the country would have an on-demand taxi pick them up and take them there. We've reduced maternal mortality and child mortality by 27% through that initiative in Tanzania, which has now been rolled out to Lesotho.
We take from that there's scope for additional collaboration and bring that kind of skill and scale into HIV and AIDS and for children and adolescents and so on. Harald, just because I see our time, how do you think about innovations as they apply? I mean, Gilead has been in the fight since the beginning, has made countless contributions to the fight. What are you excited about in terms of further innovation?
What excites me is that although we have many or most of the tools, we aren't there yet. We have not been able to end the epidemic for everyone everywhere. And therefore, I invite all of us to think about innovation also in terms of business model innovation, because business is needed for ending the HIV epidemic. Now, great things rarely happen in our comfort zones. So we need to leave our comfort zones and think, how can we align better? Not on the goal, because the goal seems to be very clear, but on the underlying incentive structures. I sometimes see disconnects here, and I think there's value in aligning those incentive structures. That would mean if the overarching goal really is to end the epidemic, why is ViiV a competitor to Gilead? Of course, there needs to be competition. However, when it comes to working in specific, highly endemic country situations, I wonder whether the competitor isn't the obstacles or the virus itself. So can't we think about a joint target intervention profile on a higher level and then subsumize what is really needed as a collaborative to reach that goal? I leave it with that. I don't have the solution, by the way.
Whoa.
We have a lot of innovation, but I don't have.
You said 2 or 3 things there that we could talk about for quite some time. Very interesting. Thank you for asking us to think about it. I saw a couple of nods and I saw a couple of eyebrows. So that means you raised some very good points. Mamadi, PEPFAR, my goodness, PEPFAR. PEPFAR has been the leader. PEPFAR is the champion. PEPFAR has led the way in so many respects, and yet PEPFAR is the first to say, absolutely can't do it alone, need these kinds of partners and partnerships and so on and so forth. And there's a new boss at PEPFAR, Dr. John Nkengasong. He's very conscious of the fact that children are left behind. He speaks to that. Can you, he's only been there, what, 8 weeks, 9 weeks or so?
3 months.
3 months. Can you give us a sense of your and his thinking, new directions, new priorities at PEPFAR that we could hold out hope is going to help move the needle, including around children and coverage and treatment and so on?
Absolutely. So first of all, thank you for the invitation to be here. And it would be remiss of me to not mention the fact that President Biden is hosting the Global Fund's replenishment tomorrow. And there's no better place than Malawi that shows the success of PEPFAR's collaboration with the Global Fund. And I wanted to just acknowledge the minister and the work that we've done there together. So I wish the ambassador was here himself to speak on his behalf, but happy to be here to say a couple of things from PEPFAR's perspective. The ambassador speaks of that he is building on the foundation of the giants that led PEPFAR before him. And so that formulation of a data-driven program, civil society consulted, always impactful, accountable, transparent, and now equity focused is the way he's steering the ship. So I wanted to make sure we mention that. The populations we serve, the priority populations, our MSM populations, our FSWs, our transgender, our adolescent girls and young women, and of course, as you mentioned, Chip, the children who live with HIV, where their viral load suppressions are at levels of 40% in comparison with adults of 70%, means that there is a lot of work still left to do, and we're grateful for EGPAF's pushing us. In terms of innovation, I wanted to leave you with at least one point that the ambassador has been very clear about, that for him, we are going to bring change about by introducing a new generation of partners. We have a lot of partners that have been with us, and we're glad we're going to continue to work with them, but we need that new generation of partners. We also need new regional dialogue. So we must end the inequalities on who does the manufacturing and expand the collaboration. PEPFAR, like us, learned with eyes wide open what COVID exposed, and I appreciate some of the points that you just made about the power of patients' own innovations during the pandemic, the utility of digital health, and also about our workforce. So we are looking to transform the way we all partner together. Philippe, we've been talking a lot about some of that, and yeah, look forward to what's ahead. Thank you.
Thank you, Mamadi, very much. Those are very clear points, and we love the emphasis on inequities and the notion of sort of viewing the issues through an inequalities lens. And when you do that, what do you see first in the foreground? You see children. So anytime we're really talking about inequities, we also then have to talk about children and emphasize children and consider when we're doing strategy, when we're doing policy, when we're constructing budgets, are they addressing the needs of children? And with the ambassador and your and other leadership I just think we're coming into a period where we can hope, but expect even more progress with the innovations that these remarkable leaders are bringing forward. We're at time. It's the fastest 25 minutes I've ever seen. Thank you all for being so punctual and interesting with your points. Thank you for accepting our invitation. And just encourage everyone where you can step forward, where you want to. Sorry if I had my back to a third of the room. We welcome additional collaboration, additional ideas with those that want to be a part of the fight and the accomplishment of an AIDS-free generation. Thank you very much.
Thank you.